So basically, this is the end of the month, and this is the last video I'm going to do about COVID. The COVID hubs are shutting down, which means that there's no more COVID hub. So if you look at my previous videos, I talked about the symptoms of COVID, how to recognize COVID. I also talked about, how to manage your COVID symptoms at home. I looked at how to use a pulse oximeter in terms of checking your oxygen levels. For instance, if your oxygen levels is less than 94%, you really should be seeing a doctor. If it's less than 92%, you should be calling 999. Ambulance takes you to hospital. I also talked about treatment of COVID. I looked at setting research that was being done into COVID. We talked about ivermectin, which unfortunately that video had to be taken down because it violated YouTube's copyright policies. Well, whatever. I also talked about dealing with long COVID. I looked at one of the most common symptoms of long COVID, which is the loss of smell. We looked at different aspects of treatment of loss of smell. We looked at steroids. Again, we looked at ivermectin for loss of smell. We looked at smell training, vitamin C, zinc, and all these other remedies that you can take to help you with loss of smell. So I did cover COVID quite intensely. I also talked about travel updates in terms of COVID, when to do your PCR tests. Also with COVID, I covered the antiviral treatments. We looked at antiviral treatments such as sotrovimab, monoclonal antibodies, they're usually called. I also looked at, what's that name? Is it molnupiravir? I can never pronounce that name, but that's another antiviral tablet that I usually take for, I think, 5 to 7 days. And usually the whole idea of taking this medication is to prevent admissions to hospital. So basically you're put in a high risk category. You might be asthmatic, you might be diabetic, you might have kidney problems, and other sorts of problems like multiple sclerosis, you name it, heart problems, lung problems. And you'll be eligible to have this antiviral treatment, or you might be eligible for the monoclonal antibody treatment, depending on what category you fall in. I also have got videos on that as well. So I've done quite a good number of videos on COVID. No more videos on COVID, that's done. This is my last day of working in the COVID hub. After this, depending on if there's not another second wave, because we've had lots of waves, but if there is another wave of COVID that might lead to a lockdown, you might see me in the COVID hub again. But this is my last day of the COVID hub. I've learned lots of things working in the COVID hub for the last 2 years. I've made lots of, friends, lots of good colleagues, lots of good patients. It's been a blast. It's been an experience. So I just want to thank you all for, clicking on, watching my videos, sharing, and whatever you've done, and all the comments that you've dropped. But this is it. Let's say goodbye to COVID. Let's go back to normal, and let's try and live again. It's been a while. So thank you very much. Feel free to drop any comments. If you have any video suggestions that you would like me to do, I've got lots of other videos not on COVID related topics. So please subscribe, watch, and share. Take care.